From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Monday, September 20th. I'm Lena Tillett. This week, the CDC will take up the decision to recommend booster shots to those over the age of 65 and considered high risk. An FDA panel signed off on the recommendation on Friday, but rejected signing off on the booster for those 16 and older. Former FDA Commissioner Dr. McClellan spoke with WRAL soon after Friday's vote about next steps and who should and should not be preparing for a booster.
Dr. McClellan, thank you so much for being with us. First, we saw a rejection for the 16 and older booster, then a recommendation for people 65 and older, as well as those at high risk. You know, this vaccine issue has always been why me or why not me, whether we receive the vaccine or not. Why reject one group but not the other here?
Well, Gerald, good to be back with you. This is important news for a lot of Americans. So I think behind this is the fact that the vaccines, all of them, are safe and very effective in preventing COVID and COVID complications. But we are starting to see that effectiveness does go down a bit over time. And that's especially important for people who are in higher risk groups, those over 65, those with a health condition, people who work in healthcare or maybe schools or other settings where they're around a lot of people that could transmit, or they could transmit the infection to someone else. And what we're seeing with the booster, and this is for the Pfizer vaccine in particular, is very strong recommendations for those individuals in higher risk groups to get a booster shot after 6 months or more since their original vaccination. So that's a lot of people. The FDA and its advisors had some questions about for people who are in lower risk groups, who are younger, who got vaccinated more recently, so there's less data. For them, they're still getting very strong protection from the original vaccine. So it's more of a wait and see attitude for that group.
You know, I found the debate among the doctors really fascinating today. One doctor said she didn't think the booster shots for most Americans was needed right now, and that the FDA instead should be focusing on making sure everyone gets vaccinated in the first place to slow down the pandemic. Do you agree?
Well, Lena, I think it's very important to get as many people as possible vaccinated in this country and around the world. That's how we're going to get beyond the pandemic. And today really wasn't any new news about the vaccine itself. We know the vaccines are very safe, very effective. And FDA's job, unfortunately, isn't really to get vaccines into everyone's arm. That takes a whole lot of other agencies and the private sector, all of us working together to get good information out to make sure vaccines are accessible. I think it's going to be very important for the government, based on today's action, to make sure that we are keeping those strong efforts up so that everyone who is interested in getting a vaccine can get accurate information about it and then can get a vaccine easily, at the same time as we're making vaccines available for boosters for those who need it. And we've got a lot of vaccine supply in the United States right now. So I think we can handle both of these tasks at the same time.
Dr. McClellan, talk about what's next in the process. It still needs to be signed off by the FDA and the CDC. Walk us through how that's going to work.
There is more to come. So the next step is for FDA to make a final decision. The FDA doesn't always follow exactly what its independent advisors say to do. So they're going to weigh what they heard today along with their own views and maybe some additional considerations about the vaccines. I'd expect a decision from the FDA very soon, though. Then, as you said, this goes to the Centers for Disease Control and its advisory panel on how immunizations are actually used in practice. And they're going to focus on some practical recommendations. What specific age cutoffs, what additional populations, teachers, healthcare professionals, et cetera. So expect that to come as well in the coming days. And that's going to lead to recommendations that all of the public can act on. Also coming up, this was about the Pfizer vaccine. J&J, where I'm an independent director on the board, and Moderna are also both submitting data to FDA right now, and we should see action from the FDA about boosters for those vaccines in the coming month or so, and I'd expect similar issues to come up there. Some evidence suggesting that a booster is needed, particularly for those at higher risk, but also watching closely over the longer term, since these vaccines themselves are all very effective.
Well, I think it's safe to say we as a public are watching these processes closer than ever in history. Dr. Mark McClellan, thank you as always for breaking this down for us. We appreciate it.
Good to be with you.
For the Coronavirus News Brief, I'm Lena Tillett.